good evening, and thank you for joining us here on another Facebook Live on blackdoctor.org. I, of course, am Ellis Dean, the Director of Programming at Black Doctor, and I am really excited to bring you this conversation tonight because um, the one thing that's constant with all of us is that if we're alive, at some point we're going to get older. The longer we're alive, we're going to get older. That is inevitable. We cannot stay whatever age we are right now is not going to happen. So, um, one of the things that it can happen as we age are there's a series of other illnesses, conditions that can happen. One of those is Alzheimer's, right? And so sometimes in the community we call it Alzheimer's, we call it all kind of things, but it's Alzheimer's disease, and it is a neurological disease that impacts a great many people as they get older. So tonight's conversation is really going to be talking about Alzheimer's, what it is, what it isn't, prevention. We're also going to talk about a recent discovery, where a recent medication has been approved for the treatment of Alzheimer's. And so before you get excited about medication, because I know when you say medication, you think it's a C word, which is cure. We're not talking about a cure. There is a new medication, and so that shows that there has been some breakthrough in the research and the treatment of Alzheimer's. So we're going to be talking about all that and more tonight with two of my favorite specialists, and that is Dr. Sarah Freeman from Cedar-Sinai, as well as Dr. Alexis Simpkins, also from Cedar-Sinai. We've got a great affinity for Cedar-Sinai professionals. So, a couple of things I need you to do before we get started. First thing I need you to do is let us know where you're watching from. We'd like to know where people are watching us from all over the world. So please drop your city and state in the comments and we will give you a shout out. Number two, if you know somebody that needs this information, tag them, share this on their page. We want to get this out to as many people as possible. We cannot do that without your help. So please tag somebody or share this on your page that uses this information. And number three, what I need for you to do is if you have any questions about Alzheimer's, about the new medication, about anything we're going to be discussing tonight, please also drop those in the comments so we can get your questions asked and answered, because this show is all about you and what you need to know. The last thing I'm going to say is this: that any information that is presented during this broadcast is for informational purposes only. It is not to supplement any medical advice that you are getting if you are seeing a specialist now, if you're in your primary care physician. So if you hear something tonight that is contradictory to what you're hearing from your doctor, go back and have a conversation. Do not stop any medication. Do not stop any treatments as a result of anything we say tonight. This is for informational purposes only. So I think I have said enough. I'm going to bring on people that look better than me onto this program. Good evening, Dr. Kevin and Dr. Sickens. How are you doing?
Good, good. Good evening. Great. Nice to be here.
So, all right. So this is something that I learned. I think I may have learned it from you, Dr. Kremen. So we'll start there. That um, Alzheimer's is not the umbrella. The umbrella is dementia, and Alzheimer's is a form of dementia. So can you help our audience understand that relationship and what Alzheimer's is that distinguishes it from other types of dementia?
Sure. So you mentioned the umbrella, so this is great. And we're going to talk a little bit about what that means. So first we need to talk about what is dementia, really. So dementia is a syndrome, which means that we're basically looking at things that we can see in everyday life to help us understand what we're looking at. So dementia is really when we see that somebody has a change in their thinking, say they're having memory problems or language problems, or say they're getting lost, they have visual spatial problems. And that's also accompanied by a decline in their function. So that might be having difficulty finding their way around town when they're driving. It might be having trouble now paying bills. It might be having trouble working on the computer. It could be forgetting recipes, or even more basic things as time goes on, perhaps, not being able to remember to take medications on time, or having trouble with bathing or dressing. So when you have those two things, a cognitive decline and a functional decline, that's what the definition of dementia really means. And then once you have that definition and somebody goes to the doctor and we establish that somebody has a change in their cognition or their thinking and memory, and a change that's leading to problems being able to carry out activities that they do every day, then we then try to figure out why, right? So dementia is that umbrella, and then we try to figure out why is there dementia. So it could be due to vascular disease because somebody's had a stroke. It could be because somebody has Parkinson's disease. It could be because they've had a traumatic brain injury. And it could be due, for example, to Alzheimer's disease. And the most frequent type of dementia is Alzheimer's disease. And I think that's why sometimes people ask, well, I don't know if my mom has dementia or she has Alzheimer's disease. It's really, does she have dementia, and is it due to Alzheimer's disease?
Fantastic. That is exactly what we need to know. So we know that it's dementia and Alzheimer's is a type of dementia.
Mm-hmm.
So what distinguishes, because I understand that Alzheimer's is the most common form of dementia.
Mm-hmm.
So Dr. Simpkins, can you help us understand what are the distinguishing features that would lead you to diagnose somebody having Alzheimer's versus another type of dementia?
Sure. So if under that umbrella of cognitive problems, so basically the person's not able to think as quickly and as remember tasks and do things, take care of themselves as easily as they were before, you're trying to figure out why the neurons in the brain aren't functioning well. One could be that you're losing neurons because there is a degenerative process going on. So something toxic around the neurons, or the neurons are damaged in some way and dying over time. Those things are primarily related to a neurologic dysfunction from the nerves themselves. Other things that can cause someone to have a dementia would be a vascular cause, meaning there's not enough blood flow to the neurons and to keep them alive and to keep them healthy. So there's the vascular component, and then there are a whole nother set of the neurodegenerative disorders where the neurons are actually dying off themselves. And that would include things like Alzheimer's disease, where you have a buildup of amyloid that's toxic to the neurons and causes the neurons to die or to be dysfunctional, or that there's a response that leads to degeneration of the brain itself. Often patients can have components of both. They may have more of one than the other, but vascular cognitive impairment or an Alzheimer's disease are very common causes of dementia. Sometimes patients may have what we call a mixed pattern, where they have components of both. So it's important to also think about things that you can do for prevention if you're just trying to prevent dementia altogether, because if you can at least protect the vascular supply to the brain, that can help with some of those vascular causes of dementia. So that would be doing things that are life's essential 8. And that is something that everyone can look up on the American Heart Association to discover what their life essential 8 score is. It's a wonderful tool that allows you to determine how well you are preventing cardiovascular disease in comparison to everyone else in the United States. And it also gives you tools so that you can learn how to adjust your lifestyle to make a meaningful improvement in your overall life trajectory, and being able to live a long, healthy life while you're protecting your wisdom, because you are making sure that the blood vessels at least are healthy, outside of the Alzheimer's component where there's a buildup of amyloid, which can be toxic to the neurons.
All right, so you said a big word there, and what's amyloid? What is that? Is that a protein? What is amyloid?
So, Dr. Freeman, you want to comment on amyloid?
Sure. Yeah, I was going to say. So amyloid, we don't know exactly what amyloid does, but amyloid is a protein that is found in our brains and is one of the 2 identifiable proteins that when scientists look under the microscope and they look at brains of people who have Alzheimer's disease, they see amyloid. It's thought that perhaps it might even be protective. For example, as you go through life and you get, you have various illnesses or whatever, that the amyloid may actually be trying to help wall off viruses or other things, trying to be protective. But at some point, it doesn't get cleared out once it's done its job. And then it becomes more inflammatory and irritable to the brain. And then it starts a cycle of inflammation. The other thing that amyloid, we think, might do is, because it's sticking around longer than it should, it then, because of its signals and the inflammations that it's causing, signals another protein that we also see under the microscope called tau to build up. And tau is very important for keeping the skeleton of the neurons that we have in our brains together. We basically, just like you have a skeleton in your body and you have in between, say, all the bones, you have ligaments that keep the bones together. The tau is like a ligament, and it helps keep the structure of these neurons that help us think together. But when the neurons start getting ill in Alzheimer's disease, they start folding up. And then because they're folding, the neurons, basically the skeleton starts to crumble, and then the neurons can't really work anymore. And when the neurons can't talk to each other anymore is when you start to see the signs that we see of people having memory difficulties or feeling more depressed or irritability or whatever the behavioral signs are. So really, we look for both of those proteins, and it's thought that the cognitive changes that we see, the thinking changes we see in Alzheimer's are really related more to the tau buildup than the amyloid. But we see the amyloid changes first.
So excessive amyloid first, and then does the amyloid impact the tau, or tau?
Yes. So it's thought so. It's thought that amyloid is really kind of interesting in that it can build up for perhaps 20 or 30 years before you ever have any signs of memory or thinking problems. And that as it builds up over time, at some point, it's very irritable to the brain. And that's what then kicks off eventually affecting the tau. And it's really once the tau starts building up and affecting the neurons that, you really need neurons to be able to think. So once you have neurons that are affected and they're not able to function as well, that's really where you see the actual cognitive, the changes in memory and thinking and behavior that we see associated with Alzheimer's disease.
So Dr. Simpkins, there's already a quick question. Can you repeat the website that you mentioned?
The American Heart Association's Life's Essential 8. So it's basically kind of sort of an app. It allows you to put in all of this information that was developed from an NHANES database, which is patients from across the United States. And they came up with a scoring system that goes up to 100 so that you can figure out sort of where your score is on all of these preventative things. So these are the things that you can do to help to prevent, a problem before it's happening when it's related to vascular brain health.
Is that it? The Life's Essential 8?
Yeah, Life's Essential 8 for the American Heart Association. And basically it'll ask you information about like your diet, blood pressure, your cholesterol, how well you're sleeping, how your social connectedness, sleep, mood, and you can come up with a score and then take that and read more information about things that you can modify yourself to increase your score so you get a higher score. And also take that to your providers, to your primary care, your cardiologist, your neurologist, and discuss ways of being able to promote a healthier lifestyle so that you can at least protect the vascular contribution to healthy neurons in the brain.
Okay, I'm gonna say what the doctors can't say because they're very nice people. Don't lie. If you take the Life's Essential 8, don't lie, because you can lie to a lot of people. Don't lie about yourself. Don't lie to yourself. Tell the truth so you can get a true score.
Yeah.
And then you can get, because I'm assuming that based on the range of your score, they're going to give you some recommendations of lifestyle change.
Yeah.
Don't try to get the highest score, and then you not making the necessary changes to improve your vascular brain health. So,
right. And it's tailored to you. It'll be tailored to whatever responses you put in. And I think that it's important. I know that. So Alzheimer's disease and vascular cognitive impairment are two separate kind of baskets of things that can cause cognitive problems. But, we at least have some things that we know will help to prevent the vascular contribution. And patients often will have a mixture of both. So this is something you can do something about right now, even if it's just taking a 30-minute walk every day, or making sure you're getting good sleep and controlling your stress and changing your diet. And that doesn't require a fancy pill or fancy new shiny thing to help you live a long life where you're protecting your wisdom. So we want to make sure that we're protecting all this wisdom that we have that we're building, right?
Exactly, because that's one of the benefits of getting older is to share it with anybody that will listen to your wisdom, even when they don't ask for it. That's that's the beautiful part about being older. That's you
Right.
want to be
Right.
able to do that, don't you? And and,
Exactly.
and we had in the month of June, that was our Men's Health Month series. We did a series on we talked about heart health, and
Hmm.
we had a vascular neurologist on. We talked about the relationship between dementia and heart disease and hypertension. And that's where the study looked at the NIH and they did all these great studies there. So so when you say you got hypertension, black folks, I'm talking to y'all. When you say you got hypertension, it has a significant impact on many other areas of your body. It's not just I got high blood pressure. That can affect your brain health. It can definitely affect your kidney health by causing chronic kidney disease. We're talking about a number of conditions that just flow from, and we're not even talking about congestive heart failure, heart attack, all of those other things, you all of those other things that come from hypertension. So when your doctor says you've got to control your blood pressure, it's very serious because it can lead to many, many, many other diseases. We'll put that stamp on there. So that was a great job, Dr. Simpkins. Thank you so much for that. So our audience is, going back to Dr. Delos, we're talking black folks. So what is the kind of the prevalence in terms of rate of Alzheimer's in black communities and the impact on our community?
So, what we know is that um, amongst Blacks, it's probably affecting about between 14 to 20% of Blacks in this country. When we look at who's at risk and who, for example, even just has cognitive changes, maybe not even dementia, but they're starting to have memory problems, what we know is that it's at least in 14% of Blacks. And if you look at every age, like if you break things down, like 55 to 64 and then 65 to 74, et cetera, with each decade, that prevalence, so the amount of people who are affected, it goes up. Now that's true for everybody, right?
Right.
The prevalence of memory problems and dementia goes up with age. That affects every single population and ethnic and racial group. But what we know is that when people are, say, 55 to 64 and they're Black, it affects about 4.8% of the population, whereas it's about 1% of others.
Okay.
And by the time you get to 85 plus, it's affecting 55% of Blacks and 26 or 27% of others. And that's not broken down, but that's just people who have difficulty with, thinking and memory. We know that in general, people who have are at risk for strokes, or for example, African Americans are more affected by stroke. There's 44% more likely to die from a stroke,
Hmm.
72% more likely to have diabetes, 25% more likely to have heart disease, and twice as likely to have Alzheimer's disease. And you can see again, we're sort of circling around these vascular issues because it's very common in general. And so this is, one more thing. When we look at who's at risk in general for getting dementia, forget about even what kind. Again, we see that Blacks are at the top of the list. So 38% of Blacks age 65 and older are at risk of having dementia develop in the next 25 years. And that's higher than, say, the American Indian, it's 35%, Latino, 32%, whites, 30%, and then Asian Americans, 28%, and then Pacific Islander, 25%. So African American are leading that, and we're trying to understand, what that is. Now, it may be because there's increased vascular risk factors, and there's a lot of interaction between that. But there's a lot of other things besides medical that may go into that. Um, and what we know is that with, say, 20% of the people who have Alzheimer's disease being Black, they actually bear about 30% of the cost, right? So it's a very expensive disease. It costs about $321 billion right now to take care of everybody. And that's including seeing the doctor, It's including getting all the medical tests, the medications, and honestly, all the unpaid care that we don't think about, right? We have family members who are taking time off to take care of our loved ones. And that's going to balloon to about $1 trillion by about 2050. But African Americans are shouldering more of that cost. That's about 33% of that. This cost is more so than other communities in this country. I'll stop there and let you guide me which direction you want me to go next.
I'm processing right now.
I know, it's a lot of
Like,
numbers.
yeah, because Anne was like, "What? Why are blacks 55%?" I was like, "Where was the 55%?"
I know.
It was a lot of numbers, but I
Yeah.
think ultimately, what I want our audience to recognize is um, it's a higher risk. That risk increases as we get older, and we're shouldering a higher financial burden as a result. So those are two things. If you didn't hear anything that Dr. Crimmins just said, it's hard to process because there's a lot of numbers in there. Blacks are at higher risk of developing some form of dementia, including Alzheimer, and we're bearing a higher percentage of the burden financially because there is a reluctance, and we just did a show on caretaking last week, and blacks are more reluctant to put their family members in homes and care facilities, and so they bring them into their personal homes, and that causes some other risks and financial risks that comes over bearing as a result. The other thing I thought about, Dr. Scribner, when you're talking, and I may ask this to Dr. Simpkins, is you're given the numbers, and that is, those are diagnosed cases. How many people, is there an estimate that we could put on that maybe aren't even getting diagnosed with dementia or Alzheimer's, and even though they have the symptoms, and probably if they were brought in, they would get diagnosed, but they're just like, that's normal. Just don't let her do this. Don't leave her in the house by herself. You get the list of instructions on how to deal with mama, but she's not going into the doctor. So how much is that?
Right. I'm not exactly sure of what the number actually is of people who are undiagnosed. It's a little bit hard to know, right? Because those people are not coming to the doctor. And so we're not really sure. But yes, our numbers are probably an underestimate. I mean, the other thing is that a lot of times too, it's not always recorded in the medical record, even if people do know. What we know is that about 50% of people who are diagnosed with dementia, and this is all comers, no matter what background they are, 50% of people don't even know that they have it because they haven't really been told. I think there's a lot of stigma and worry still, even within the medical community, about giving this diagnosis because it's such a serious one that there's a lot of worry that if you tell a patient or their family that that's what's happening, that they're going to get very upset and it's going to be hard to deal with, and it's opening a Pandora's box, and they don't have enough time to talk about it, and there's just so many things. It's going to take away driving, and so a lot of times you'll see that it is clear that that's what the diagnosis is, but it's not in the chart.
Yeah, I would say probably the most important thing just to take home is still that Black Americans, if you look at the scope of neurologic disease within the United States, we have the highest morbidity and mortality, and meaning the most deaths and the most health consequences, according to the last published information from the National Institute of Neurological Disorders from the NIH in the Neurology Green Journal. They put out 10 articles about healthcare disparities and where things are going with the incidence of neurologic disease, and amongst the people with the highest burden of that weight, people who are often underrepresented in clinical trials and things like that, such as African Americans or people who maybe aren't the highest percentage in the U.S. population, may actually be affected by quite a bit by the disease morbidity from neurologic disorders. So the main thing to focus on is just to know that, okay, there's a risk here. We know there's a risk. I'm at risk. My family members are at risk. My mom, my dad, my sisters, my cousins. What are we all going to do collectively for prevention, knowing that there's this underlying risk and then taking control of that, the lifestyle things and the prevention that you can do from a behavioral standpoint to try to move the needle on that.
Well, you just moved us right into the next segment, I guess. And if you're just joining us, we're talking to Dr. Sarah Freeman and Dr. Alexis Simpkins, both from Cedars-Sinai. We're talking about Alzheimer's, and we're talking about Black people with Alzheimer's, and there's a new medication. But you said a word there that was a question that was coming in from one of the viewers, and that word is prevention, right? And so we all want to be in that space, whether we're talking about diabetes, heart disease, everything. Like, we want to be able to prevent. We want to get from intervention, that's when you have treatments and medication, to prevention, which is you don't make development because you're doing what you need to do. Anne's asked a question. It's your question, Anne. So I'm going to read it directly. What can we do to reduce our risk factors, and what can we do to prevent the onset of dementia?
So again, like a lot of the things that will help, at least that we know have some additive benefit for protecting the vasculature, are the things that are listed in the Life's Essential 8. So the reason why I keep bringing that up is because it's a great tool that not only tells you what the risk factors are, but then allows you to determine what your risk is, and they'll give you instructional information on how to adjust your risk score. So things like high blood pressure, no, it's just like a garden hose. If you have the garden hose spigot turned on full force all the time, that garden hose, there's no way it's going to last for a long period of time. So that's the same deal with blood pressure. Not having good blood pressure control over a long period of time is just going to create a lot of damage and inflammation to the blood vessels. So hypertension, high cholesterol, you don't want to have a lot of extra fat floating around just available to kind of stick on blood vessels that would supply the brain and other body systems. Exercise is important. When we exercise, it releases all kinds of good endorphins, makes us feel good, and then also it will release healthy chemicals to keep blood vessels healthy, keep the neurons healthy. Having a good social network is important because it's good to communicate. If you don't use it, you lose it. So staying interactive with people, having a good social network is also important. Having good sleep. When we sleep, we help to remove some of the toxins and things like that are from the normal process of brain functioning during the day. And kind of sort of what we eat. We're learning more about, food as medicine, and, the how important it is that we are eating foods that are going to be supplying us with the nutrients that we need, but not adding on extra inflammation and things like that. So those are some big kind of topics. But when you look at the Life's Essential A website, it will help you to kind of march through all of those major things that are for vascular prevention. Dr. Cribbin, you can comment, but I don't think that there's a specific prevention drug. I know that we're also have this new drug out for Alzheimer's, but there's not like a specific, if I take this drug now and then I'm going to prevent any type of Alzheimer's disease from ever happening to me, kind of thing.
Right, exactly. That's true. There is no such thing. If there were, that would be amazing. But there isn't. But you started with a great list, and I was going to add on to your list because in addition to all the things that you said, which is exactly what I would say to somebody if they were coming to clinic in my clinic. So you can see there's a lot of overlap. You're seeing stroke patients or people at risk, and I'm seeing people that may have had that, but are also, may have neurodegeneration, and I'm giving them the same list. The other thing that I think we've been paying attention to as well, is making sure that you can see, like if you have cataracts, or if you're having trouble with macular degeneration or glaucoma, it's really important to take care of your vision. It's also important to take care of your hearing. So if you're having trouble hearing, you really need to get hearing aids. There's been a lot of research and papers recently telling us that, the brain doesn't like not getting information. Our brain is meant to be taking in all kinds of information, even if it's, sometimes people say, well, I'm not talking to that many people during the day, so I don't need hearing aids. That's not true. It's not even just when you need them for conversations, but you may not realize it, but you're taking in, information in your environment, and it helps you be oriented in what's going on, even though you're not maybe actively paying attention to it. So it's really important to be able to see. It's important to hear. And the other thing that's really important that, again, has been something like, people don't want to talk about it too much, but it's really important to talk about your mental health. If you're depressed, if you have anxiety, these conditions cause actual inflammation in your brain and may, be bad in the long run. So it's really important if you're feeling down and you're depressed, it's important to think about getting therapy. Think about a medication or maybe both, but it's really important to not leave that unanswered or undealt with, because all of these things are related. So those are other things that are big categories that I would add in terms of, total health.
Yeah, I completely agree with you. Yes, the hearing aids, even for the patients I see who have had a stroke,
Mm-hmm.
sometimes those subtle problems that they had before but were compensating for really become problematic after they start developing some of the vascular components of dementia. So, again, it's all about prevention. And like you said, and like we were saying before, if you don't use it, you will lose these skills that you've developed. So, it is important that, people oftentimes really don't want to, either for cosmetic reasons, or it's just the fear of someone thinking that they may not be as astute or more the frail or something like that if they have to get a hearing aid. And there's it's just a tool to help you live your best life. And if there's a tool out there that's going to help be able to do more, be more active, have more fun, live your best life, I'd say, should be a low threshold for going after it.
Here, here.
I love it. I love it. So yeah. So we have a series of shows and hosts here, and so I've got a Rolodex of advice in my head. Um, and one of the things that I found to be easy was it was an acronym EMTS: Eat, Move, Think, Sleep. And so those are the best preventative message for any most, I won't say any, but most conditions. If you're eating right, eating healthy, that's eating a more plant forward diet, reducing your meat intake and fats, sugar, reduce your salt intake, eat that plant in the most natural form possible. That helps. Movement. We're not going to exercise is viewed differently, but any type of movement where you're getting your heart rate up for 30 minutes per day, 20 to 30 minutes per day. Uh, Thinking, that's more of stress related. So we got to reduce that stress because we know stress increases cortisol. Cortisol increases inflammation, and then we've got a problem, right? So we've got to reduce our stress, and then of course we have to get sleep. And I believe for an adult, it's about 6 to 8 hours
Yes.
um, is the appropriate amount of sleep for an adult. And that basically that is 2 REM cycles per night, because the REM cycle takes about 3 hours to go through, and that's 2 REM cycles per night, and that helps the body refresh, relax, and get rid of those toxins. And you get up first thing in the morning, go to the bathroom, flushing out those toxins. If you're not getting enough rest, you're not flushing it out clearly, completely, and then it lags over to the next day, and that can cause a host of other issues. So EMTS, eat, move, think, sleep, and that will help prevent a great number of diseases. As we're talking with Dr. Simpkins about vascular illness and stroke. Um, it's another one of those list of conditions that can happen with hypertension and stroke. And so we have to make sure, and the stroke can lead to that stroke, can lead to dementia, it can lead to down that line, and now we got other problems. And so you can see how it's all connected, and it all could be something that we can have control over now in our blood pressure. If it's normal, cool. If it's high, then we need to do the things we need to do to lower it. So you mentioned the medication as we're here. We're wrapping. So great refresher on prevalence in the Black community, what Alzheimer is in relation to other forms of dementia. Dementia is an umbrella. Alzheimer is a form of dementia. We talked about prevalence in the Black community and understanding the Black community. The Black people have higher risk, and carry a higher financial burden. You can forget all the other statistics if you don't remember anything else we talked about. Those are the two most important things. And so therefore, and then we talked about preventative measures. You need to go to the American Heart Association Essential 8, right? It's there. I'm going to put it back on screen for you to look it up after the show, finish the show. But after the show, go to the American Heart Association website, fill out that form. That's something that you could do in the privacy of your home, and you can start working on those things as you're working with your physician, your primary care physician, to reduce some of your risk factors. And so, um, okay, so they want to know, they want to hear you talk more about the details on diet and whole food. We'll talk about that. I promise you, one of our YouTube viewers, we're going to talk to that. But we need to talk about the medication, right? Because you mentioned it, and it's been fairly recently. I want to say September. This medication the first ever medication that would be approved for the treatment of Alzheimer's. And so, Dr. Crimmin, could you kind of help people understand um, what it is, what it does, and why it's groundbreaking, and what it doesn't do? And that's most important, what it doesn't do.
Yeah, no, exactly. So there's been a lot of talk in the news about a drug that you're probably hearing. Its name is Leqembi, but I'll call it lecanemab. And so you know how all drugs have two names. So so Leqembi or lecanemab actually got provisional approval from the FDA in January of 2023, and then it got full approval in July. So that's why this year there's been a lot of talk about it. And full approval means that you have to show not only that it can help with cognition, right? So help with memory and thinking, but that it actually has an impact on function and, how we live our lives. That's sort of, so provisional approval meant that they were able to show that they could affect the amyloid, right? And they were using that as a stand-in for changing the disease, reducing disease. But they didn't quite have the measures for a clinical outcome. And the clinical outcome being slowing down cognitive changes, slowing down functional decline. So in July, they actually had more of that data and they were able to give it full approval. So this is a medication that is given every 2 weeks by IV. So it's an infusion. You have to go to an infusion center. Usually these are in clinics at hospitals, or there are some freestanding infusion clinics, just like people get other infusions, say, for cancer care. And this medication basically pulls amyloid out of the brain. So remember, we were talking about how amyloid can build up and build up and build up. So this is trying to remove amyloid from the brain, and it does do that. It does it quite effectively. So for example, if you look at pictures, and I do have some if we want to pull them up, but basically what you can see is people at the beginning of the trial that was 18 months. At the beginning, they took pictures of their brain and they were able to see the amyloid in their brain with a special kind of scan called a PET scan. And then they imaged them at the end. And people who were randomized to get the drug basically had scans that looked normal at the end. And people who had, not been on the drug after 18 months continued to accumulate the amyloid. And what they could see is that amyloid, it was pulling out amyloid even at 3 months. You can see a significant difference between the group of people who were getting the drug versus not. But even more so, and what makes this important, is that we've seen that in other drugs before that are similar that you haven't heard of. And the reason you haven't heard of them is because those drugs, even though they could pull amyloid out, did not show any effect on people's memory and thinking. And this drug did. So this is like the first time that we've really seen clearly that happened. So what they saw was that they saw a slowing on a certain test called the CDR sum of boxes. Not important to really know what that is, but where they use that a lot in clinical trials. It essentially is a test that looks at memory. It looks at people's ability to be oriented in time. It looks at their ability to problem solve. But it also looks at people's ability to continue their home and like activities at home and with their hobbies. It also looks at their ability to take care of themselves. Can they bathe? Can they dress? Things like that. And so they took that and they looked at it, and basically it showed that it's sort of slowing. So there was a 27% slowing between the group that had the drug and the group that didn't get the drug. So a slowing, and it was statistically significant. It's a big gap between those who got it and didn't. There was also about a 25% slowing in functional decline. So again, slowing down in the progression of people's loss of ability to do their everyday activities of daily living. So that sounds extremely impressive. It's pretty exciting. And they saw it across the board. And they saw it basically for every group. It didn't benefit women as well as men, but it still did show a trend that way. It's harder to show things in terms of, I have to say, the breakdown for ethnicity is hard. So I'm going to go straight to it. These studies, I actually made a slide because I was trying to look at it myself in terms of, how many people are really in these studies and who's really in it. So for this particular study, I'm going to just scroll over on my own screen so that I can make sure that I have the numbers right. But between all of the studies that have been done right now, the three biggies are aducanumab, which was actually still has provisional approval. It made a lot of splash in 2021, but you're not seeing it a lot because there's a little bit of controversy about whether that medication really did have a benefit in terms of memory and thinking and functionality. That's why we're not spending much time talking about that one. But lecanemab or Leqembi, the breakdown for that was that there were 2.5% of the people in the study were Black. Okay. 77% were white and 17% were Asian, 12% were Latino. So when you look at that, again, the majority of white, but there's a discrepancy because when you think about the country being about 13% Black and there's only 2.5% of people in this study that are Black, it's a little bit hard to know in general then how does that really impact people? You know what I mean? It's harder to make a direct. But that said, the group analysis is that there was definitely a slowing in cognition and cognitive decline and a slowing in functional decline. I'll stop there so that you can ask questions because there's more stuff to talk about, like side effects, et cetera. But I'll stop there so that you can summarize, take and refocus.
It's I'm going to get on my soapbox. I got it right here underneath my desk. Black folks, we got to get in these clinical trials. I mean, and that's really, we have a page on the blackdoctor.org website. It's got a clinical trial resource center. We have a whole resource center telling about clinical trials, how to get in them, what trials are there available to you. But the bottom line is this: if we want medications and treatments that are going to be not only impactful but helpful for our community, we have to at least match our population distribution in the clinical trial. What does that mean? That's a fancy way of saying 13% of the population, we need to be 13% of the clinical trial participants. 13% of the population, 2.5. So that gap could be significant when it starts talking about side effects, overall impact, in terms of the improvement that they're showing. It could be different. It could be greater. We don't know because there's not enough people in the clinical trial. Another example is COVID. There was a significant, and some of the manufacturers stopped their trials to make sure that they got enough people of color in the trials. And so we saw that the vaccines that were developed during COVID were generally effective for all peoples, including people of color, because they had a significant number of people of color in the trials. And so if we can do that across the board, whether it's prostate cancer, breast cancer, Alzheimer's, whatever, we need to be at least commiserate with our I put my soapbox to that. I'm off of it, but I just have to. It just bothers me to see that because and now that we've got Fedora, which is the fancy way of saying the FDA is saying pharmaceutical companies have to present a plan to recruit people of color to participate in clinical trials. And so if they don't have a plan to do it, then their drug it's going to take longer for any drug to get approved. They have to have a plan. And that's why we have this clinical resource center, the clinical trial resource center. That's why we're speaking more and more about it, because they're going to be looking for you. They need us, right? They need us in order to get better medications, in order to get better treatments. They got to have a plan. And so we have to step up and say, you know what, I'm going to participate. Whether you're healthy, and some of the trials were healthy people, some of the trials are for people that are experiencing the condition. You've got to read it, you've got to research it and find out. So we made it easy for you. So you don't look, clinicaltrials.org. I've been on there myself. It could be a little bit cumbersome. We've narrowed it down a little bit, made it easier. Go to and then start asking the providers, and that's my proof. Okay, that notwithstanding, Dr. Simpkins, were you excited when LeCambi got the full approval? When you heard about it, were you? I mean, I know because you've been part of it. You've been reading the research. You've been watching
Yeah.
this kind of. So it's kind of like the parents on Christmas Day. Like I went and bought the gift. I wrapped it. So when the kids get excited, they're like, "Ah, I've seen this process, right?" So
Yeah.
you're not as excited, but were you really excited that now have full approval and have people start getting access to this medication?
Okay. Well, I'd say I was intrigued. I was intrigued. It's what I would say. I mean,
Nice safe word. That's a nice safe word.
there. I mean, one, it would be great to have more generalizable representation of patients within the study, and in particular, as a stroke neurologist, I was most concerned about some of the um, side effects that were noted in the publication for this drug. And that being that some of the patients developed some inflammation and even bleeding in the brain after being on this medication. Those side effects is called ARIA, but it's basically you could just say that they had some swelling, and then they had some blood leaking out in between the blood-brain barrier. There's a nice seal in between where the blood sits and where the brain tissue is. And we don't really like for the blood components in the brain tissue to be kind of communicating directly together like that. There's a sealant layer in between that only lets the food and the nutrients that we need to go across. Otherwise, they're separated apart. But some of the patients, after being on that medication, the blood-brain barrier was a little bit more leaky, and we started to see some edema and blood components crossing over. And so that, I think, was one of the things that I said, that's important to know and to think about in the context of this medication and having people to discuss this with their providers. It really has to be a patient tailored kind of discussion on whether this medication is appropriate for a person or not. And also, and another reason why I kept bringing up things like about the vascular component is because if you already have, changes on like a brain scan that shows you've already got too much vascular damage, that would suggest that you would be at higher risk, this new drug or therapy you might not even be a candidate for. You've missed the boat because you didn't have the prevention part taken care of previously. So these are important things to really think about when it comes to your overall health, even if you haven't really don't have any kind of manifestations of having problems with your thinking. It's important for all families to consider these things and how they want to prevent dementia early on before there's already a lot of signs and symptoms and things like that, because you have to start the medication early before you're already having all the major signs and symptoms, and there is that risk associated with it. So you don't want to already have too much issues going on so that you wouldn't even be a candidate for it.
Gotcha. That you bring out some really great points there, Doc, and I know y'all will get into the pricing piece of it,
Mm-hmm.
right? And so, but pricing for medications, particularly new medications that are not generic yet, can be high. And I'm just going to say that part of it. And so that not only that creates a barrier, right? The price of medications creates a barrier for certain groups, in particular lower income, and you know that people of color tend to lean that way, and it also creates it can lend itself to bias in terms of who gets recommended for this particular medication, and that's coming through the providers. And so now we've got some other issues. We might not be able to get to today because we only have an hour, but I just wanted to make sure we want to educate our audience on it. So if you're a doctor, if you've got a family member, a parent, grandparent, whatever, that's starting to show that, or are on the first stages of Alzheimer's, you might want to start having that conversation. Um, and so, oh yeah, somebody said it costs thousands of dollars. So I'm sure it's a new medication and it's not generic yet. And so I'm sure it's, and then you talk about an infusion therapy, which is different because that requires time. Like not only does it require money, and then we haven't even talked about if managed care is going to cover it yet. So that's that. And right there, she put the question in right before I said, is it covered by insurance? That's a question, right?
Right.
For your insurance, and that's part of that aging process. And so we're in October, and we're getting close to open enrollment. So I would just kind of make that plug for people if you are using Medicare, Medicaid. Make sure you re-enroll every year, and there's always changes. We're going to be doing a program here on the 26th of October at 8 p.m. talking about open enrollment. We've got somebody from the Office of Minority Health at CMS that's going to be coming on. We've got some other Virginia. We got a person that assistant that she's great. Miss Betty is fantastic, and she's going to talk about her experience with open enrollment. And so I would encourage you, but please, 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 if you do not have coverage at all, go to open enrollment, healthcare.gov, enroll in something so you can get some sort of coverage. So that's a good question, and that's a question for, since it's a new medication, it's probably going to have to go through some sort of approval process with your insurance, and you're probably going to have it submitted. Uh, Pre-approval before you'll get your first infusion. But talk to your provider and make sure you call your insurance company to ensure to get the specifics for your particular case. But ultimately, what I'm hearing is it's a promising medication that is available that can slow, not a cure, that can slow the process. There are some concerns with regards to bleeding that you need to have some conversations about. Side effects, Dr. Quibben, are there any other side effects that you want?
Yeah, I'm just thinking of like a bunch of different things to kind of punctuate what you've said. So, right. So brain bleeding and brain swelling are a known potential side effect of every medication in this class. And there's going to be others coming out probably in the future that will be similar. So it's not just this medication, it's a class effect. Headache was another thing. And sometimes people get a reaction after they get an infusion. So sometimes people will feel like flu-like symptoms or things like that. So those are the major things. The thing about these side effects in the brain are that sometimes you don't get any symptoms from it. So in 75% of the cases, you don't know that you're having it. And so because of that, this therapy requires that you get extra MRIs, pictures of your brain when you first start this medication. It's required. So just alluding to what you were saying in terms of cost, the medication itself costs about $26,000 a year. We probably would not be giving this forever. It's probably going to be given for a year, maybe 18 months, because that's as long as the trial was. We don't have any more data to know, but it will be covered by by Medicare, is covering 80% of the cost. Whether other providers will follow suit, we don't know yet. The other thing is that in order to qualify for this medication, you really need a good medical evaluation because it's not for everybody. It's for people who have either pre-dementia, so mild cognitive impairment, where you have memory and thinking problems, but you haven't lost functional abilities at all. So you don't even have dementia. It's just before dementia. Or you have mild dementia, very mild stages. It is not for people who have had dementia for many years. It's not for people who have moderate or severe dementia. That's already, we know that won't work. The other thing is that you need to have other tests to make sure that you're even appropriate. So not only do you need the test to show that you have mild impairment or mild dementia, but then you need to have proof that you have amyloid in your brain, because we're not going to give you a medication if you don't have amyloid in it. So that requires either getting spinal fluid, a spinal tap, or a special PET scan that can detect amyloid. I've heard that they're working on trying to get this amyloid PET covered to some degree, but right now it's really not covered. That's very expensive. And then you have to have an MRI to make sure you don't have bleeding in your brain, and then serial MRIs, and then a genetic test to make sure, because there's certain people with a certain type of gene that makes you more susceptible to bleeding and swelling in your brain, and we need to know that. And then you have the infusion, et cetera, et cetera, et cetera. So it's quite costly. Not all of it's going to be covered by insurance, and we don't know what's going to be covered by insurance and what's not. It's still a moving target. So we will be seeing more information as time goes on, but there's a big rush to like, hey, can I get this? Can I qualify? But just know there's various steps in a workup that need to be done with your doctor to even see if you qualify. And certain things you're not going to qualify. So again, if you have moderate or severe dementia, no. If you are on a blood thinner because you have atrial fibrillation, you really won't probably qualify. They say that you can do it, but I can tell you that we have reservations about what the safety of that. So you're going to have to talk to your doctor about really, is it realistic or not?
Mm-hmm.
And that right there is why we're doing this program, because we want to give you the information that you need so you can make an informed decision about this. The other thing I would add on top of that, thank you, that was fantastic, Dr. Freeman. I would say on top of that is, you heard that, multiple MRIs, expensive PET scan, other genetic testing, all of these barriers before you even get to the $26,000 drug that's only covered by Medicare at this point. So if your doctor doesn't mention it to you or your parent, about your parent, whatever, you don't immediately say it's a racial. Your doctor could be considering all of those steps that come into cost, time consideration. The MRI takes time, infusion takes time, all this other stuff. They may be considering that for you. Now, what I would say to healthcare providers, if you're watching this, have the conversation at least and let them make that decision. Let your patient make that decision. That's not for you, but they could be trying to rule that out. Oh, well, it's too much. Have that decision and let them decide whether or not it's too much. And so that's what I'm saying to both sides. So patient side, don't jump to conclusions saying, oh, they're not going to give it to me because I'm black. No. They may be considering something else. From the healthcare provider side, offer it to have a conversation. Right? It's not for severe, for mild, early onset, some mild symptoms. You're showing some problems. So I know, but I would say, as we talked about throughout this program, we're going to say it again. So live smarter, thrive brighter. I hope you're still watching. Food is medicine, right? Please, if you're not healthy, and somebody said this on the show earlier this week, and I said I'm going to steal it, but I'm going to give her credit, Dr. April Spencer. She said, you're not losing weight, you're gaining life. And for every pound that you lose, you could be really enhancing. It's like a multiplying effect. 10 pounds of weight loss can have a significant impact on your blood pressure, on your blood sugar, on your ability to exercise better, and your ability to sleep better. Just 10 pounds. Now that ratio goes up if you're obese, but just start with 10 pounds. Can have a significant impact. So you have the most control. Every piece of food you put in your mouth is a health decision. If you think about what you eat in that way, it'll help you eat healthier, because every time you take the bite of that hamburger, that's a health decision. You have that salad, that's a health decision. And so we got to make more healthier decisions in our diet to help prevent a lot of these chronics. There's a hereditary component. We're going to talk about that. Showing in certain illnesses, some things that you might not, that could have some genetic components to it. If you do have a family history of Alzheimer's, some genetic testing might come into play, but that's also expensive. So you don't get unnecessary genetic testing. I know there's organizations and companies that are offering it to you for a cost, but don't get unnecessary. But if there's a family history of something you want to know that you got that gene, please. But do what you can with what you eat, and that's the thing that I would say. So final words we'll start with you, Dr. Simpkins. If there's something that you missed that you wanted to say throughout this broadcast, or there's something that you want to repeat to get people to make sure that as we're wrapping up, that you say, if you don't remember anything, you need to remember this.
If you don't remember anything, remember prevention, because if you already have brain signs of microhemorrhages from uncontrolled high blood pressure, superficial siderosis, so like a bleeding on the brain from uncontrolled high blood pressure, all of these things from the food, the whole life's essential eight, also the hearing and the seeing, thanks Dr. Crimmon. Then even with this new fancy therapy, which has all these risks, you won't even be a candidate for it because your brain MRI is going to screen you out
Right.
from the beginning. So live a healthy life to help protect your wisdom and to give you a longer, happier, more fulfilled life.
Amen. Dr. Crimmon.
So I will just add that I think it's very important that when you go to the doctor, or if you're even thinking that there's something going on with your memory, to advocate for yourself. Go and ask for an evaluation. And if they're like, it's not a big deal, but you feel like it is, then try another doctor. It's just so important to speak up and to find out what you can do. Maybe it's just, something easy like your thyroid is off or something, but if it's not, and we need to know about this stuff earlier, we want to get the proper treatment, whatever that is, whether it's this new medication or the older ones that we have. But it's so important to ask your doctor when if something's going on, don't let it sit, because it's better to get on top of it earlier and to speak up. It's really important.
Yeah. So thank you for everybody for your questions, for staying with us. I will say as a comment, obesity is a diagnosis, not a description. So please understand, treat it as such, um, and understand that there's like over 230 conditions that spawn from obesity. So if your doctor is saying that you're obese, do not take that personally. That is a diagnosis, and so we have to get control of it because you can alleviate a lot of other conditions by just losing weight. So I'm going to reiterate my my talking points there, my soapbox moment there about a health decision is what you do. So thank you again for joining us. We want to thank our friends at Cedar Sinai for loaning these two wonderful, wonderful, wonderful physicians to us today. They gave some great information. Have the conversation with your doctor. Make sure you're eating right. Do what you need to do to protect your wisdom. I like that, Dr. Simpson. I'm gonna borrow that too, but I'm gonna give you credit for that one, Dr. Simpson. Protect your wisdom.
Yeah.
So you got it. You got it. Protect it. We'll see y'all next time. Y'all have a great evening.
All right. Take care.